let's go ahead and grab our foam roller, and we're going to tie the lightest Theraband around it. In a knot, coming against the wall, we'll lie supine with both feet anchoring the roller against the wall. You're going to keep one hand by your side, and we're going to do angels, snow angels on the floor, imprinting the backs of the arms as we slide up all the way with the arms overhead, trying to keep our back ribs, our shoulder blades imprinting into the floor as we do this, engaging the abdominals, and then sliding back to the hips. Going at a nice slow tempo as to not pull the front of the shoulder, lifting up and lowering down. Make sure you're breathing here. Inhale to lower. Exhale to lift. The resistance is on the way up. Once we start going down, the resistance gets easier. Don't think so much about the weight of the band. Think rather about how heavy you can imprint your body into the floor. We're trying to create more back awareness to combat the kyphosis. Let's go ahead and sit up, switch the roller, come back down. We'll put our feet against it and begin on the other side. Imprinting the body, focusing on making sure that you're imprinting evenly on both sides of the body. Since you're working one side, the other side shouldn't be lifting or hiking up. Be aware. Close those front ribs, reach the tailbone away, still keeping some lumbar extension. Your feet are dorsiflexed, again, great to combat the plantar flexion. And you're breathing, you hear your exhales like you're fogging a mirror. Or if you're bracing, you can make a sound like that as if you were being punched in the gut. All of which will contract that transverse abdominis. Let's move into a prone position now. Taking the roller, you can take the band off of it. Lying prone, we'll have the roller under our forearms, slightly above them. And once you're set up, the palms should be facing in towards one another. Bony protrusions of the hips anchored into the floor. Abs pulled in and up. We're going to lift into upper back extension, exhaling to lift. Inhale at the top, pull the abs in, brace them. Staying here, exhale the air out. Shoulders are plugged down the back. Inhale again, brace the abs, and exhale, lower back down with control. Inhale at the bottom. Brace the abs, exhale, lift up. Hold it here. Inhale, brace the abs, and exhale, lower down. 2 more like that. Inhale. Lift the pelvic floor muscles, come up. Inhale. Exhale, stay. Inhale. Exhale, lower. 1 more time. Inhale. Brace the abs, exhale, lift. Inhale at the top, exhale. Inhale, prepare. And exhale, lower down. Grab that band, go ahead and put it back on the foam roller in the same position on one side. We're going to set up on all fours for pointer dog. Whatever arm is weakest, let's work that arm first. Opposite arm and leg extend. The leg can stay down, toes are on the ground, or it can lift up for more of a challenge for the abs. We're going to lift the opposite arm as leg up, 2, 3, and lower, 2, 3. Keep the shoulder plug down, lift, 2, 3, close those ribs, and lower, 2, 3. Take it up, 2, 3, and lower, 2, 3. Lift, 2, 3, and lower, 2, 3. 3 more, take it up, 2, 3, and lower, 2, 3. Exhaling the air out. Inhaling to lower. Trying to not wobble on the roller, staying nice and firm through your abdomen. And lower. 2, 3. Go ahead and switch sides. Setting up. Knees tracking right under the hip. Wrist right under the shoulder. Soft bend in your supporting elbow. Palm facing in towards the face. Dorsiflex that back leg, the foot, so the toes are pointing, reaching towards you. And go ahead, begin with the arm work. We're keeping that leg in an isometric hold. The arm is just moving up, overhead, engaging the back of the shoulder. And lower, 2, 3. Go ahead and lift, 2, 3, and lower, 2, 3. Keeping that tempo. 4 more. Focusing on bracing the abdominal wall here, keeping the shoulders plugged down the back, keeping the ribs closed. You can almost think about a hand hovering above the shoulder blades and trying to puff the shoulder blades up to reach that hand. We want the serratus anterior, the shoulder anchor, to be active. And 2 more. Checking in with your breath. Let's set up for our next exercise. We'll need the anti-burst ball. And we have our lightest band tied around. Go ahead and switch the position of the roller so that we can work your non-dominant side first. We're going to do some lateral flexion, side bending with the ball between the knees, and then adding the bottom arm as a lever with an isometric hold. So let's begin taking your side bend over, inhale, add the bottom arm, exhale, hold it here. Inhale 1, breathe, exhale 1, inhale 2, exhale 2, and come right back up to center. A big thing that happens here, keep going, is the ribs pushing out, especially once you add the resistance of the bottom arm that is sweeping from your hip all the way out to that T. Palms are facing one another. Shoulders need to stay down the back, and you need to keep your ribs closed. On your next one, remember we're holding for 2 full inhales and exhales before coming back to our starting position. The ball is there just so you can feel the inner line of the body squeezing in with the adductors, pulling in and up with the pelvic floor muscles. You can think about your tailbone reaching down and back, creating that lumbar extension we worked on during our abdominal work. When you're holding that isometric hold with the resistance of the band, make sure the shoulder is down the back and the ribs are closed. Let's go ahead and switch sides. Turning the roller around, setting up on your knees. The toes are tucked. And since this side is your dominant side, if it feels relatively easy to hold the position, you can challenge yourself when you're in lateral flexion to lift the toes of the opposite leg. So if you're bending to the right, you'll lift your left toes. And if you're bending to your left, you'll lift your right toes. So once you go over, you inhale, you add the bottom arm, hold it here. Inhale 1, exhale 1, the opposite toes are lifted to challenge the obliques even more. Inhale 2, exhale 2, and you bring your body back upright. Last one, taking it over, holding. Inhale 1, breathe, exhale 1, inhale 2, exhale 2, bringing it back upright, making your way off of the roller, pulling the band off, and untying the knot. Great work.